Hi, and welcome to the Post-Acute Point of View, our discussion hub for healthcare technology in the out-of-hospital space. Here we talk about the latest news and views on trends and innovation that can impact the way post-acute care providers work. And we take a look at how technology can make a difference in today's changing healthcare landscape in both home-based and facility-based care organizations and the lives of the people they serve. Today we hear from Kevin Whitehurst, Senior Vice President of Skilled Nursing Solutions for MatrixCare, and his special guest. Let's dive in.
Hi, this is Kevin Keith Whitehurst, Senior Vice President of MatrixCare, and I want to thank you all for joining us today. I'm here today with Amy Wootton, Director of Nutrition Management at MatrixCare. Today we're going to be talking about recognizing malnutrition in the data. So let's go ahead and jump into this. Why don't we get started, Amy? And let's begin by having you tell our listeners your origin story. We want to give them a little more background on your journey into nutrition management and the post-acute care technology.
Sure. Hi, Kevin. Thanks for the
Hi.
opportunity. Believe it or not, my first path in college was computer science. It was from really my grandparents, in particular my grandmother, who struggled to monitor her diabetes when I first was introduced to the concept of nutrition as even a career choice. So, of course, going back, I've spent most of my dietitian career now in the senior healthcare, loving on my grandparents as the beginning for my career choice. I enjoyed many years as a staff dietitian in both long-term and acute care, and I kind of moved around into the food service management, always liking to be hands-on. And I eventually took a corporate leader position over 90 long-term care settings, and I offered guidance, set policy, and operational expectations to those in our organization. And I began to study nutrition informatics with programs from the Academy Nutrition and Dietetics. And I was fortunate to be able to find MatrixCare as an organization that values and supports nutrition as a key component of the care for our seniors.
That's excellent. And we're certainly delighted to have you as part of the MatrixCare team. So, Amy, I know that the MatrixCare Meal Tracker is the leading nutrition management solution out there. But can you describe why there is so much concern about malnutrition?
Sure. Up to 1 out of 2 older adults is at risk for becoming malnourished. And studies show the condition affects 35 to 60% of older residents in long term care facilities. It is a patient safety risk and can have detrimental effects, especially when other conditions are present. The healthcare cost of disease associated malnutrition in older adults is estimated to be 51 billion per year. With effective screening, assessment, diagnosis, and intervention, malnutrition can be identified and addressed to effectively reduce mortality rates, readmission rates, and even control costs. This can be strengthened with best practices, quality standards, and measures for malnutrition adopted across the continuum of care. This is easy when you have elite technology like MatrixCare.
Very good information there, Amy. Can you walk us through these malnutrition related challenges? What are they?
Sure. Malnutrition is often a combination of many factors that are individually recognized and possibly treated, but still the diagnosis goes undiagnosed. It's not simply finding a resident with decreased appetite and giving them a temporary supplement, and that may help in the interim. But think of things like multi medication use, inflammatory issues, depression, GI problems, difficulty chewing, swallowing, all leading to decreased nutrient intake, which in turn can diminish immune response and wound healing and increase infection rates. These all can increase risk for functional disability, frailty, and even increase falls. So the challenge is finding all of these and addressing each to prevent malnutrition. Clinical experts who can know where to look and assess for this information and gather it in the data, like maybe a registered dietitian, are so important to an organization. If caregivers do not have accurate areas to identify that data and it's hard to find and missed, it can be detrimental. And this is why identification timely is key.
That's really interesting. When I look at this, I know that MatrixCare has a malnutrition screening tool. Can you describe the benefits of that to our audience?
Sure, early recognition and treatment of that malnutrition are not only beneficial for the patient's health, but can reduce the overall cost, as I mentioned, to the community. So, providers, nursing, and dietetic professionals need accurate tools to reinforce their findings upon admission and recurring assessments and looking at that over time. So, using a validated and an appropriate screening tool is the first step for caregivers. The 2-question tool from the MST or malnutrition screening tool, it's related to weight loss and appetite and can be completed by any health professional, and it's generally done by nursing upon admission to the community, but it can be used throughout their stay. And the score can indicate at risk or malnourished right away, and an immediate referral for further assessments can be made to a registered dietitian.
So I understand that these workflows and tracking capabilities of the vitals page also contribute to the success. Can you elaborate on how nutrition experts benefit from their use of it?
Sure, vital signs are objective measures like height, weight, BMI that are used to monitor acute and chronic disease and can serve as like a basic communication tool about resident status across the discipline. Any change from an individual reference range may indicate important warning signs. So, additionally, dietitians use this intake percent at meals that are also in the vitals that are captured to identify any risk.
I see. Okay. Thank you for that explanation. And then I know the observation is a critical part of the MatrixCare platform. If you could describe the significance of observation information for getting in front of the malnutrition crisis.
Sure. Observation or assessment information helps to identify in detail if a resident is potentially at risk for malnutrition, and it helps to have the backbone for that diagnosis. Observation data can be reviewed to document information gathered on diet, food, eating, history, and generally their nutrition status. It helps evaluate needs of the resident versus what they're consuming. Dietitians use this area to provide medical nutrition therapy through what we call nutrition care process. It's a way of documentation, and that's found in observations. And nursing admission data shares oral status, presence of dentures, vision, hearing, mental status. Other data gathering tools also assess for depression, loss of appetite, and motivation to eat. And social service observation reveals psychosocial and economic aspects of a resident's life that can provide insight on food intake and availability, maybe prior to their admission or if they're going to go home or be discharged. Each discipline's use of an observation tool can help to identify malnutrition risk. So, the resources such as MatrixCare's observations can be the key to successfully identifying that diagnosis of malnutrition.
Thank you. There's just so much value there. We spoke about so many areas where Matrix Care is a valuable tool to monitor the nutritional status. And I understand there's more. So let's continue the conversation and tell our listeners more about it. So let's just start describing the front line.
Sure, our healthcare heroes caring for our seniors during COVID crisis is now more than ever being faced with malnutrition challenges. Nurses, social services, therapists all have a critical role in recognizing factors that place the older adult at risk for malnutrition. They're working to monitor their intake closely, offering alternatives and supplements, and even referring to the registered dietitian for follow-up and continuing monitoring. The food managers and their team are working hard to provide appropriate menus that meet the resident preferences and keep nutrient needs being met. This nutrition interventions have been successful supporting malnourished residents. We know that. The providers that address malnutrition risk across the care continuum as a team with both comprehensive and collaborative efforts, they'll see the positive outcomes then.
That's some good information, and thank you for really describing that in the detail that you did. I do also hear that there are additional benefits that providers can leverage under PDPM. Can you talk about that?
Of course, as the patient driven payment model supports malnutrition identification, it does not give true definition on what that is and how to capture the diagnosis. So, clinicians will need to look to the reference guidance from places like Aspen and the Academy of Nutrition to support their findings of that diagnosis. Interesting, after 1 year, an analysis was done of the new payment model, and it showed missed opportunities of non therapy ancillary comorbidities, specifically malnutrition, meaning the documentation was in the data but not compiled to a diagnosis. So PDPM providers will need to identify nutrition criteria and have supporting documentation of the criteria to capture the diagnosis. And early screening, observational assessments, and identification can diagnose and maximize the payment for resident care.
Well, thank you for breaking that down. And, I look at this and all of the things that you described so far about Matrix here, being able to really support the needs in this area. There's some other tools, and I'd like for you to talk a little bit more about some of the tools in Matrix Care that support care planning for the malnourished individuals.
Sure. MatrixCare's care plan process supports communicating interventions across the team that will help manage and resolve the malnourished resident. So, nutrition interventions that are put in place, such as honoring resident preferences, additional meal portions, altered meal times, snacks, oral supplements, routine monitoring and evaluation, they'll all result in proper treatment of the resident when everyone is on board, right? And that care becomes optimal. So MatrixCare makes using an interdisciplinary approach from their care plans easy.
I see. So, Amy, can we look a little deeper into this? I know we've covered a lot of valuable information about Matrix Care, but I understand there's even more. Can you share any additional information about what Meal Tracker can do and some more about Matrix Care?
Well, sure, of course, that's my favorite. Well, we've identified
Great.
nutrition interventions, and routine monitoring and evaluation of those interventions will result in proper treatment. But a key piece to this success falls on the food service director and dietitians and dining service team to provide those interventions. Having a dining management software that can customize the needs of the individual resident profile details to each meal or snack is paramount. Meal tracker users can implement those appropriate interventions like additional portions, specific high calorie or fortified foods at meals, honor resident likes and avoid dislikes, implement supplements and snacks, even adjust meal times to provide a more person-centered care approach. Meal Tracker has profile reporting and individual tray tickets that offer exact details on what is to be provided, taking away all that guesswork for the dietary team. Meal Tracker can help you identify and manage weight loss with our complete nutrition feature with things like auto calculation of needs, entering enteral tracking. We have weight monitoring and specifically our unique weight alert flag and malnutrition risk alert. These features will help notify dietary users of those at potential risk. Our extensive recipe file and seasonal menus that can be customized are included and individualized or can be individualized for your facility at no additional cost, and it provides a true all-in-one solution. So these tools are critical in today's dining environment, especially now more than ever as malnutrition is on the rise, and nutrition service team members are often the key to capturing it. So early nutrition interventions have been shown substantially to reduce that readmission rate, as well as complication rate, length of stay, cost of care, and in some cases, mortality. And Meal Tracker is the answer for those in need of elite dining software.
Excellent information. Excellent, Amy. For our listeners out there, we definitely want to thank you all for joining us today. Great topic, recognizing malnutrition in the data. And I also want to thank Amy Wootton for that wealth of information. Thank you so much for sharing, Amy.
Well, thank you, Kevin, for having me. And I love to talk about nutrition.
That concludes the latest episode of the Post-Acute Point of View from MatrixCare. We have a lot of guests and topics coming up that you won't want to miss, so be sure to subscribe. If you've enjoyed today's podcast, and if you have a topic you'd like us to discuss, leave us a review. To learn more about MatrixCare and our solutions and services, visit matrixcare.com. You can also follow us on LinkedIn, Twitter, and Facebook. Thank you for listening. Be well, and we'll see you next time.